Yeah, good evening, everybody. How are you? Good evening. Welcome to another session of Ask the Doctor. This is the Christmas edition. We decided not to have this program today, but some people said let's come online today. This program holds every Sunday, 8 p.m. West African time. My name is Dr. Frederick Unigbohai, and you know, good life in a sense. I can see some people already online joining in. How are you? Good evening. So tell me, where are you joining me from? Good evening, everybody. I see you. Good evening. Say hi. So today is the Christmas edition. We wanted to cancel the program, but we decided to just come online and talk with you and gist with you. So ask anything askable. I hope you can hear me, right? I hope you can all hear me. Oh yeah, talk to me. Who do we have in the house? Good evening. Good evening. I just hope you guys can hear me. Hello. Yeah, I see somebody here. Emmanuel. Hello. Pat Kish Emmanuel. How are you? Can you hear me? If you can hear me, say yes, I can hear you. Yeah, let's go. We have 24 people watching me. We are live. We are live on Facebook and we are live on YouTube. Joseph Root says yes. Keep up the good work. Thank you. So share the live stream. Yes, we can hear you. Okay, I see you. Hello. Yes, we can hear you. Oh my God. Yeah, I see you. Joseph Roots, how are you? Mercy, good evening. Yeah, yes, we can hear you. Good, loud and clear. So tell me, where are you joining me from? Tell me, guys, where are you joining me from? Yes, sir, you are loud and clear. Okay, let's go. Rose, Rose, talk to me. Yes, I can hear you. Yes, so okay, from Sokoto State. Annie from PH. Annie, how are you? Yeah, we have somebody from YouTube. Merry Christmas, everybody. Merry Christmas. Abdul Ganiyu. Merry Christmas. Classic World. Merry Christmas. So today's edition is just an open day. Abuja. Okay, from Abuja. Agbesi ID. Good evening. Good evening. So to every one of you, Merry Christmas. Annie, what happened? You say you're not fine. Good evening. So let's gist, let's gist, let's gist, let's gist. Okay. Merry Christmas. I am watching from Port Harcourt. Joseph Roots from Kaduna. I'm at home. I went to visit my family. So this is why you are having this background, and this is why you can't really see my face clearly. Smart, good evening. Mercy Okoduga. I'm not. You are not what, please? Portia, Merry Christmas. I'm watching from the UK. Abdul Ganiyu from the United Kingdom. That's nice. From Kwara State. Okay, so if you have any gist for me, tell me if you have any gist. Oh yeah, give me your gist. Let's gist, let's gist. Good evening. So please share the live stream. Everybody share the live stream. Number one. Number two, tag your friends. Share the live, share the live, share the live. Before you start, how many of us have shared the live stream? Good evening from Lagos. Doris, uniqueness. Watching from Port Harcourt. I just wanted to have a random discussion tonight, but I noticed that everybody want to ask medical, 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 medical. Ah, now wow, oh, wow. Okay, oh, what is the cause of boil in a particular place every month? It comes with headache and fever. Well, I have no idea. A particular place every month. It should be investigated. That is not boil, madam. That is not ordinary boil. That is not an ordinary boil. So I don't know if it is boil at a particular place every month with headache and fever. That is not boil. I think so. Something else is causing that swelling. How can a woman with high blood sugar manage early pregnancy? I have answered you before, Mr. Stanley. I've answered it before. You cannot manage high blood sugar at home now. If you are pregnant, you should go and see your doctor. How are you doing today? Merry Christmas, Antonia. Merry Christmas. You can't manage high blood sugar at home if you are pregnant. Do you want to lose the pregnancy, Stanley? Odira, Stanley, I don't share. Thank you for sharing. Oh, God go bless you. The rest people no want share. Oh. So if you are pregnant and you have a high blood sugar or you are diabetic, you should be seeing your doctor now. You want to look for alternative on social media, hmm? Or you don't want the pregnancy because what you're trying to do is something that might make you lose the pregnancy. Oh yeah, let's go. Talk to me quickly. Today's program might be very short, maybe 30 minutes, and then we are done. Oh yeah, share. Everybody share the live stream. Share the live stream. Share the live stream. Share the live stream. Let's go. So what did you eat for Christmas? Oh yeah, what did you eat for Christmas? For those on YouTube, say hello. And if this is your first time here, say hi. What causes handshaking at age 30 plus? Handshaking. Well, many things. Ladies and gentlemen, share the live stream. Many things can make your hand to be shaking at that age. It could be lifestyle related, it could be age, it could be genetic, it could be degenerative condition, it could be kidney problem, it could be electrolyte disorder, it could be hormonal issue. Share. Thank you for sharing. Olaleko, good evening. I want to ask, what can I do to boost my fertility? I'm trying for a baby. You don't want to see a doctor. We have Dr. Israel here. Dr. Israel is in the house. Dr. Israel, good evening. How you day?
I'm fine. Good evening, everybody. Merry Christmas.
Merry Christmas. How are you now?
I'm okay. Well, why you saying dark today?
The thing dark because hello.
I'm hearing you.
Okay, you can hear me, Abi. It dark because say I go house, so I don't know. It's not too bright.
Yeah, just ask me not the. You can see my own is bright today.
I don't even know what they do my volume right now. The thing just a mess up
Now
since
you can
morning.
see my
Okay,
own
good.
is bright.
But you dey hear me loud and clear, Abi?
Yes, I'm hearing you loud and clear.
Okay, so somebody they ask, he says, I want to ask, what can I do to boost my fertility? I'm trying for a baby.
Okay. Remember, I think someone have asked this question before, and we said the first thing to do is to. Is it a girl, a lady? Yes, Antonia. I think the first thing to do is if she knows her ovulation period and and all that. And also if he has visited a gynecologist to be even sure if he has if he's ovulating or not. Because when you say boosting your fertility, if you're ovulating, yes, some persons may not ovulate every time, but if you're ovulating, there's every tendency that you can become pregnant. So you need to visit a gynecologist first and also you also need to know your ovulation period. When you know your ovulation period, you'll be able to know when to meet your husband and how to meet your husband so that you can become pregnant. Now, one thing we normally say is that yeah, ovulation is once in every cycle, once in every cycle. So if your cycle is like a 28-day cycle, um, is often most of the time the 14th day of that cycle plus or minus 2 days, plus or minus 2 days, which simply means that it can be the 12th, it can be the 13th, it can be the 14th, it can be the 15th.
I guess we have an issue with Dr. Israel's network. Dr. Israel, what happened to your network again? Oh God. So Antonia, Dr. Israel has advised you. A friend of mine is stealing blood. Not always, Sha. Ha. Blood in the stool is not something to joke with. It comes and go. It's a sign. There's something going on. Maybe your friend has a tear. Maybe your friend has a polyp, or your friend has hemorrhoid. So these are things that your friend would need to find out from a doctor. But here we don't really know what is happening to your friend. After a stillbirth, can you conceive that same month? No, madam. No. You have to give your body time. Jessica, good evening. Give your body time. You want to conceive immediately that same month. Haba, madam, you need to be taken care of now. Merry Christmas. Okay, I ate rice. I see. Is there any assurance for treating staphylococcus? Yes, your medical doctor will manage you. Hmm? So see a doctor. There's a video on staphylococcus on my page. I don't know where this staphylococcus is coming from every time. I don't share. Thank you for sharing. Merry Christmas. Thank you for sharing. Ladies and gentlemen, share the live, share the live. I call you, you know grip pick. Abi, you know what make I can't chop chicken. No verse. I call you back now. I will see a doctor. Thank you. Okay. Good evening, everybody. Welcome. What could cause anxiety in the middle of the chest, sir? Like when the heartbeat is felt in the middle of the chest. That is not anxiety. That is like palpitation. Ibrahim. So, um, if you are having a heartbeat in the middle of your chest, Ibrahim, first of all, you want to check yourself. Do you even know your blood pressure? Are you stressed? Do you take coffee? Do you take caffeine? Do you take energy drinks? What is your age? Do you have any family history of heart problems? These are things that would help you. Huh? If this has been happening to you for a very long time, then you should see a doctor. But if this stuff just started a few days ago, try to rest, check your blood pressure, sleep more, and see if it will resolve. But if it doesn't, please speak with a doctor. Can pregnant woman use warm drugs? Because I have many drugs. No, go and see your doctor, please. We don't. I'm not going to say yes to that. Go and see your doctor. I believe you have registered for antenatal. If someone ovulates, how many days the egg will stay? 1 day. There's a video on my page. Olamide. There's a video on my page. 1 day. Sometimes 36 hours. It's 24 hours. 1 day. 1 day. What is the average number of words? What is the average number of words, please? Can you be pregnant without menstruation or ovulate without it? Yes, it can happen, but it's very rare. It's very rare. It's very rare. Very, very rare, but it's possible. Doctor, is it possible for a girl not to be pregnant and not see her monthly flow going to 3 months now? She did pregnancy test and it showed negative. What can be the cause? Classic word. You're on YouTube, right? There's a video on YouTube on this question, delayed period. So you can go to YouTube and watch the video. I made a video on this. It's possible. A lady will not be pregnant and she will not see her period for 3 months. There are many, many causes. Huh? There are many, 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 many causes that can make a woman not see her period for 3 months. Hormonal imbalance, age, stress, weight loss, weight gain, so many things. What is the average number of prolactin and other hormones? What do you mean by other hormones, madam? What do you mean by other hormones? Chizoba, hello, how are you? Ladies and gentlemen, are you sharing the live? Are you sharing the live? Please share the live stream. Dr. Israel is back. Doctor, what is happening to your voice now? It's like you are cold. Please take care of yourself. Sure, sure, sure. Thank you. Yeah, my voice is cold. It's down. Doctor, please, sir, teach us how to do it. Make you earn. I for transfer money to you for Christmas and New Year, but I'm Almaji. Okay, Dr. Israel is here. Dr. Israel, Alpha, can you hear me now?
Yeah, yeah, I can hear you. Sorry, I don't know what happened. Glow network just disappeared and just came back now.
Okay. Oh yeah, send us Christmas now. Send us Christmas and New Year gift
Somebody
now.
said somebody said you should take hot tea for your voice. The person has just and don't do
Yes.
your doctor. He don't turn your doctor.
Yes. Yeah, yeah, yeah. Doctor been trying to
That's
get pregnant. So let's make it. So Dr. Israel, let's make it very fast so that we can take many questions. Doctor, I've been trying to get pregnant for 4 years now. I have visited gynecology medically. She said I'm fine. Can I still get pregnant? I believe that's what you're asking. Okay. What would you advise, Mr. Israel? Mr. Israel, your network again. Hey, my God, oh. Mr. Israel, what they do your network? Good evening. Yes, so yes, madam, you can get pregnant. But the best person to ask is actually your gynecologist. The best person to ask is actually your gynecologist that would help you. They would tell you maybe you can keep trying more or you go for IUI, IVF, depending. Teresa, thanks for the apt response. Say, God bless you. Merry Christmas. Merry Christmas. Please, sir, please, I need your number. I don't give out my number online, madam. There's a link on my page. Click on the link, huh? What is the cause of heaviness in the breast? Ah, I can't say, oh, I can't say. There are many things now. Hormonal changes, um, premenstrual syndrome. Your breast can be heavy when it's close to your period. Apart from that, if your breast is heavy, you should be examined though. I need a gynecologist. Where are you based? Noble baby, where are you based? Merry Christmas. Please, which gynecologist is okay? Is it government or private hospital? Anyone is okay. Anyone is okay. Are you sharing the live stream, guys? Share the live stream now. Make una share now. And make una send stars for me for Christmas. Yes. Anyone is okay, government or private. As long as you can afford it, anyone is okay. Good evening, sir. Good life. Yeah. Doctor, is it only when a girl is in her ovulation she can get pregnant? Yes, now. Classic world. You are on YouTube, Abby. Go to my page now. Watch the video on ovulation. If a woman does not ovulate, how will she get pregnant? There is no way she will get pregnant. A woman only gets pregnant when she ovulates. That's the answer. So you must ovulate to get pregnant. Good evening. Yes, I'm sharing as I can. Thank you for sharing. The rest people are not sharing. No. Thank you for going through the questions and attending to them. Okay. I hope I've been able to attend to your questions. Merry Christmas. Please share. Can someone be pregnant and still see her period? A woman should not be pregnant and see her period. A woman should not be pregnant and see her period. So if you are pregnant and you are seeing blood, please go and see your doctor. After your doctor has checked you, if there is no problem, they will tell you it is not normal to be pregnant and at the same time you are seeing blood, seeing your period. It's not normal. Is that okay? Please, I need a gynecologist. Where are you? Where are you based? I don't have anyone. No, I don't have anyone. But where are you based? Doctor, what is wrong with your voice? See, my nose is blocked and I have to come online. My nose is blocked, like very blocked. Thank you for asking. Thank you for asking. And I'm here and I'm answering questions. Sure you get. So thank you. Okay. Oh yeah, share. I base in PH. So why don't you go to the University of Port Harcourt Teaching Hospital? Why don't you go to the teaching hospital in Ikema Duel? You can go to University of Port Harcourt Teaching Hospital, UPTH. I believe you will see a gynecologist there, madam. Please. What will be the cause of whooping sound in the ear? What will be the cause of whooping sound in the ear as if you can hear the sound of your heartbeat in the right ear? Well, I don't know. Kalista, I don't know. I have no idea, Kalista, so I can't say what is causing that. I'm not going to tell you. I don't know. Trust me. Yeah. Hard luck for the voice, I swear. It's cold. much dust in the city. It's cold, cold, cold. Herbal or orthodox medicine, which is better? Anyone that you feel is okay for you. But you know where I lie, right? You know my choice. Good evening, doctor. Please, I've been having eye issues. I can't see objects that are far clearly unless I move closer. And I have run series of tests. They said it's amblyopia, that it can't be corrected again. What's your advice? I've shared your live stream. Thank you for sharing. I'm not a gynecologist, madam. Now, oh God, Dr. Israel, are you back?
Yeah, I think I'm back. I have to do my emptying. As far as the globe goes and come back, goes and come back. I don't know what is this problem.
So, Dr. Israel, what would you advise this person? Share the live, send stars, send roses. What would you advise?
I've been having issues. I can't see objects that are far clearly unless I move closer. And I've run series of tests. They said is okay, that it can be corrected again. What's your okay? What I will advise you is that I don't know where you run the test, and I don't know who told you it can be corrected. Yes, it can, but you need to see an ophthalmologist. Yeah, you can see I'm wearing a glass. I'm wearing glasses, eh? And that is most likely what you will be prescribed to wear as well. I know that some of us don't like wearing glasses. Yeah, I know of that. But uh, for the meantime, if that is what you need, and they may want to also prescribe some other investigation or do some other, or give you some other medications to help the eyes gain its ability on time. Apart from that, what you should do, as I earlier said, I don't know who you went to see at first, but what you should do, you should see an ophthalmologist. An ophthalmologist is someone that is specialized in treating the eyes. Yeah, it will not send you to see an optometrist with, maybe you will now have to do some other investigation, and then they will not tell you the whatever glasses that can suit you. Please don't. Um, I know you can. I know some of us will want to go to one of these people that sell glasses because you hear that I sell glasses, and go and buy anything. Say, okay, put it in your eyes and see if it will match your eyes. No, don't do that, because you may think that the one they give to you matches your eye on that moment, but it may cause more damage than what you are having now. So what our advice is, see an ophthalmologist who will actually prescribe you um, the right prescription for your for what you are having.
Please, can you be my gynecologist? I'm sorry, I can't be your gynecologist. I'm not a gynecologist. We are just here to educate you. Sorry, doctor, I need your WhatsApp number, please. I'm sorry, madam, I don't give out my number. If you check the screen, what is passing, we don't give out our personal contact online. If you want to chat with us, you have to, for me, you will click on the link on my profile. You will book for a private time. Yeah, I'm sorry, madam. I don't give out my contacts. I don't know if Dr. Israel does that too.
No, I don't. I don't as well. I don't.
Good evening, doctor. I have a trigger thumb. I did an x-ray and they said nothing is wrong, but I can't bend it and I still have pains. What can I do again?
Okay. Please, how old are you? That's Is it a lady?
I have no idea.
Okay, if it's a lady, we want to know your age range. So your age range can also give us an idea of what can cause that. Also, but if it's a guy, what kind of work do you do? But I want you to see and what's this guy's called now?
Orthopedic.
Orthopedic. Yes, an orthopedic surgeon. You see an orthopedic surgeon. Most of the time, maybe it's really nothing is wrong. You just need to get some pain relief and for the meantime, and with time, it corrects itself and stop paining you. But if you're not satisfied with that, like it's really disturbing you and really troubling you, see an orthopedic surgeon.
Good evening, Doctor. Happy Christmas. Yeah, Merry Christmas. Good evening. Drink hot water. Sure, I will. I'm pregnant. Congratulations. What is the average number of normal prolactin, please? Why are you asking for average number of normal prolactin? Why now? There's a range. Dr. Israel, do you have anything to answer or to say?
No, you can answer that for them if you want to.
There's nothing like average number. When you carry out a prolactin test, there's a range. The lab has a range. So I don't know why you are carrying out a prolactin test and who sent you for prolactin test. If you have a prolactin result there, take the result to your doctor or go to the University of Port Harcourt Teaching Hospital to see a gynecologist. Madam, there's a lab reference range. Can I do a DNA test? I'm pregnant. Yes, you can. You can do DNA test even while you are pregnant. It's between the range of 200 to 300,000. If you're talking about paternity test, paternity test, if that's what you're asking, Sandra, yes, you can. It's within the range of 200 to 300,000. Uh, Doctor, I am suffering from sepsis disease. What's the way out?
Well, there's nothing like sepsis disease. So I cannot tell you what you are suffering for because there's nothing like sepsis disease. What I will advise you is that if you really have sepsis, you will not be typing what you just typed because you'll be in the hospital, you'll be on admission, they'll put drip in your hands. And in fact, some sepsis, you may be using oxygen to breathe. So you don't have sepsis disease. For you to be able to type what you are typing, you don't have it. And if you think you have anything troubling you, please go to the hospital, see your doctor, and they will tell you what next to do. Please let's try and ask questions that are general, not some questions that I don't know how to say it, but I don't think there are some questions that are not supposed to be asked. They are not supposed to be asked. So, but you can ask a question for knowledge that you want to know. We will tell you. But if you are trying to make a diagnosis by yourself, we will sense it. And when we sense such thing, we will not answer you. Or yes, we will not answer you. We actually will not answer you. So please, if it's for knowledge, you ask your question based on knowledge sake, and we'll be able to give you the knowledge so that you can use it to prevent occurrence of disease conditions. Yeah. So for my brother Benjamin, please, you don't have sepsis disease. Thank you.
Yeah.
Because there's nothing like
So, yeah. There's also like sepsis disease. If you have sepsis, my dear, you will be on admission. You are critically sick. Sepsis is a critical state. Thank you. So I'm 41 years old and I'm into painting. So the person that asked about the trigger finger says he's 41 and is
okay.
into painting.
Okay. It can just be your work, your work, your work, your type of
The
job that
nature
is
of the job.
actually giving you the trigger finger. Yeah, that may likely be what is giving you the trigger finger. So earlier said, if it's actually not disturbing you too much, I don't think you should trouble yourself. Just get some pain reliefs and you'll be okay with that. However, if you think it's something that you are really not you are really worried about, please see an orthopedic surgeon and let them see if there's anything they can do to the finger to stop triggering.
Yep. Those on Facebook, why are you not sending us stars? Send us stars now. Send stars. Send stars. Digital gift. Okay. Any more question? No more question. Let's see.
Yeah, today is Christmas. Now, majority of them are still doing their Christmas. Merry Christmas to everybody.
Yeah. Good evening, doctor. I am in Lagos. Is it Lutz or the military hospital? Which is better?
Okay, which of them? Okay, two of them are better. Yeah, two of them are better. But it depends on what you are going there to do. Yeah. If you go to Loot, you get all the consultants that you want to see, and you see many doctors in Loot. Yeah. If you go to military hospital, you still see the same, but you may not see all the consultants that you want to see. Because for the military hospital, okay, as I said, you will still see all the you may not see all the consultants you want to see. However, they have their clinic days. Yeah, they can come on those clinic days and they will see you. So it is now depend on your financial strength, and if you be if also how long you can wait to be attended to by a physician or a medical personnel. That will now be what you'll be looking at. Yeah, your financial state and how long you'll be able to wait to be seen by medical personnel. Because two of them are tertiary facility, and they can give you the best.
Yes,
Okay,
now
to
you will
get a
see a gynecologist. Yeah.
you will see a gynecologist in the two of them. You will see a gynecologist. Military hospital have a very good gynecology department. Same with Lutz Teaching Hospital. They also have a very good gynecology department. So that's why I said the only thing that you should be thinking about is two things: your financial strength and how long can you wait to see a medical doctor. So in military hospital, they say standby gynecologist that can see you at any time. But they have their clinic days as well.
Okay. Um. Okay. Concerning the boil, the person have injection abscess. Any small thing, that place will be paining her. Then it will result to boil. So you're always having injection boil at a particular place every month. I don't know what I would tell you. I don't know what advice to give. Dr. Israel, do you have anything to say?
Uh, if when you say injection accepts, it simply means that that person must have taken an injection. And if that's what is always triggering those boys, anytime you take that injection, you have something like boy. Anytime he takes injection, you have something like boy. I think I try to understand what you are saying, but if that's what you're saying, the good thing to do is to stop taking injections, except when they are very, very necessary. And also, it still
Yeah.
depends on the person you are meeting to give you those injections. So if maybe there are experts that are giving you the injections and you're still having injection access, I think you should stop taking injections. It just simply means that you are reacting to the injection. That is this, not the fluid that enters you, but the syringe, the needle itself. May just be that's what you are reacting to. So I will advise that except when necessary, not when you have malaria, you say you are going to know, except when really necessary, you can actually take the injection. But if it's not so, please, I don't think you should.
Okay. What causes headache? As if there is something in the head pouring.
See if there's something else. Worry. Okay. Headache can be caused by so many things, and there are different types of headache. And there are different types of headache. So, well, if you have malaria, you can have headache. Stress can cause headache. And some infections to the brain can cause headache. Injury to the brain can also cause headache. Maybe you have an accident or you hit your head somewhere, it can cause headache. Also, if you have pain, if you're having eye issues, it can also translate like headache. Some persons will be feeling the headache and they think, sorry, they'll be thinking that is the head, whereas they have issues with the eye. And shortage of blood can also give you something like headache. Yeah, as I said, yes, can also give you something like that. So these are some few causes of headache. Remember, I said stress can actually cause headache. Now, I said there are also different type of headache, and we have the migraine, stress headache. We have the wrist, what is called, then the wristband headache also. So we have different type of headache, as I said. So um, those few things I said can actually cause headache, and the few type of headache as I've given to you. So we will not be able to just tell you that this is cause of your own headache. So if you think that you're having such an headache, you're having an headache, and it's spending time is staying, and you are not comfortable with it, you need to visit the hospital so that they can investigate further. Headache is just a symptom. It's a pointer to so many other things. So that they can investigate further and know what is actually causing the headache, if it's something that is minor or if it's something that is major. Yeah, thank you.
Okay. Let's try to be very fast. Hi. Please, do eating banana on a daily basis, preferably on an empty stomach, have any side effects? I have no idea if it causes anything. Um, you can have a different fruits variety. You can take banana, oranges, you can mix it up. You understand, but I don't know if it causes any side effect in your system.
It's banana. Banana is fruits, and it's a natural vitamin and to the body. Um, and what does banana contain? That's what you should first of all think about to know if it has any side effect. Eating it on an empty stomach, after all, people eat banana and granite and they are satisfied. It's just like a food to some persons. Eating it every day, I don't think you should be. I don't think it will cause anything to you. That's for me. I don't think. But because you will not be able to eat a lot of banana, or you cannot finish a full bunch of banana one day now. So that depends on how many you take per time. Yeah. But you should remember, too much of everything they say is bad. Too much of everything, even water, too much of water is bad. Even though we know that water is yours there, but too much of it can still cause something. So it means that too much of everything, it also means that too much of banana can still give you one or two things. Yeah, if you eat a lot of banana per time, you may have running. Yeah.
I can sneeze like anything. What is the cause?
Okay, Antonia, you may just be allergic to something. So if you are sneezing often, it means that you may be allergic to something. Just for you to look for what is causing that allergy. Yeah. Yeah. That's what you should look for. You should look for what is causing the allergy, and that is what is causing you to sneeze. Perfumes, dust, cold weather, dry weather. These are some few causes of sneezing in in an allergic condition. So if you think you're always sneezing, and you should also find that you always itch your eyes, and also do you always have season of breath. So if you're having those things, and do you also cough when you're having those season of breath, you might not be thinking of something higher than just an allergic reaction. So, but you having those kind of reaction all the time, sneezing all the time, please look at your environment. Your death can also cause you to be sneezing. Your the bed you sleep on, the clothes can cause it if they have been there for a long time. You now change your bedspread and all that can also cause you to sneeze. So you have to find that and run away from it. That's the only way you can stop those many sneezing of yours.
Okay.
If it's allergic cause.
I had issues with my menstruation after I stopped 3 months family planning injection. On getting to the hospital, I was asked to go for a scan, and the scanning results according to the doctor, said system is not, but I'm stopped during menstruation. Please advise me. I don't understand this question. Please send it
System
again.
is not what?
I don't understand.
System
Send
is
it
not
again.
what?
What is the cause of itching during third trimester?
Um, okay, inching. Sometimes because of the level of the estrogen, the estrogen can actually cause inching. So that's actually the cause of the inching you are having. So when there is Dr. Temitokwe is here.
Doctor T.
Okay,
Doctor T,
yeah,
may I
Dr.
send
T
you
is
the link?
around.
May I send you link?
As I earlier said, um, the estrogen level, if it's high, can actually cause inching. Yeah.
Please, guys, send stars, send stars, send stars. After a stillbirth, how many months would I stay before I conceive?
It depend on your body system. It depends on your body system. After a stillbirth, your body system will need it's just like you giving birth. So you still you still have the local and all that. After if those ones are dried up, if your menses return immediately, you conceive immediately as well.
Dr. T, are you around? Private chat me, private chat me, private chat me, if so that I can send you the
Dr.
link.
T is around. Send him the link. He's around.
May,
Merry Christmas,
may
Dr.
private chat me.
T. He's
May
around.
private chat me. Okay,
Let,
I'll send you the link. Oh yeah. Dr.
yes.
Israel.
Good
Wait
evening,
first.
Doc. Please, what?
Dr. Israel, wait, please. Let's appreciate somebody. Um, let's appreciate somebody. So Sharon just sent a super sticker. Sharon, thank you very much. Thank you for the
Thank you,
support.
Sharon.
We appreciate you very much. Yeah, Shampoo, thank you very much. We appreciate you. Okay, Dr. Israel, go ahead.
Good evening, Doc. Please, what mandibular joint disorder and what is the cause? Okay. Uh, this is I think this is head and neck now. Yes. I don't know how to put it. When you say this, when you don't put this other there now, uh, Dr. Fred, see if you can help me out first
Okay,
before my head.
so the temporal mandibular joint is the TMJ joint around your jaw. You can have problems around your jaw. The temporal mandibular joint is called the TMJ joint. Now, this thing you are asking us, you're asking us medical question. You're not asking us question that would help us advise you. You're asking us medical or clinical questions. So there are so many types of TMJ disorders. There could be stiffness, there could be dislocation. So there are so many types. So this question you are asking is not specific. You're just asking us a broad question. Do you understand? So I don't know how we can help you. Yeah. Okay. Hey, Dr. Israel.
Okay, so the doctor said the system is normal after the scan. Yeah, after you stop any what's it called now? Uh, what did this lady stop again?
Family planning.
Yes, after you stop any family planning, yeah, even though you stop the injection or you remove the implant because these things contain some amount of hormone changers, let me call it hormone changers, that changes the hormone, that makes the brain stop producing what they should produce. Sometimes it takes some time for the brain to realize that, yes, they should start producing what they should produce. It takes some time for the body to go back to its former lifestyle. Because as at this point, they are used to what you've been giving to them. So they are used to it. So it takes some time. So your system can still be normal, everything about you can still be normal, but it just the body needs to come back to its former self before you start seeing your message again. So it can take up to, yeah, for some people 3 months, 6 months, some persons up to 6 months, they can just be like that. So it takes some time. For me, I don't think you have any problem. But if you ask me, one thing I've noticed is that once a lady is not seeing their messages and they think they're because they're within the age and they're not seeing their messages, they're already angry. They're already not angry, sorry, they're already scared. They think that they have a problem. Yeah. For you, they've been seeing your messages and you've done family planning, and that's when the messages stopped coming. What I would advise is if your doctor, I believe is a gynecologist you saw, said everything is normal, please just be calm, be patient, eat your normal diet, don't stress yourself too much, and wait for the brain and the body to rearrange itself. And the funny thing is that you may just become pregnant even before your menses come. That's it. It's as funny as that. You may just become pregnant. So even though you said your menses has not come, and once a while you can just do pregnancy test because anything can happen if you are sexually active though. If you are sexually active, so anything can happen even before the menses come. Thank you.
So what I may just add to what Dr. Israel has said is, please, if you know you have not seen a gynecologist, you just went to the lab to carry out the test, then please go and see a gynecologist because it's different. It's one thing to go to the lab and carry out a test and they say you are fine. It's another thing for you to actually see a gynecologist. Is that okay?
And that's why I said
Yeah.
the gynecologist you saw that said you are okay, then you can be okay.
Uh, Doctor, please, what causes me to be itching in my ear and I start making some funny sounds with my throat? I don't know, Dr. Israel.
I don't know. I can't know that now. Those are not
Dr. T,
questions.
Dr. T, I sent you the link. I sent you the link. I sent you the link, Dr. T, on WhatsApp. I have sent you the link. Okay.
I'm waiting for Dr. T. Today my network is good. I want to see that.
So what do you have? So what would you advise this person, Dr. Israel?
Now, for this person, I've noticed that this person have been asking a lot of questions. What I will say, if everything you've been asking is what you think is happening to you, you need to go to the hospital. Just go to the hospital, do a general checkup, so that you can give them all this complaint. Because once if you are also getting to your menopause, or maybe you are already in your menopause and you are getting old, sometimes there are so many funny things you just be feeling, and they are not something you should be troubling yourself about. It can just be a normal thing for you. So if you think all these things are troubling you, please just go to the hospital for a general checkup. For general checkup, we help you.
Dr. T Alpha.
Is Dr. T
Good evening,
around?
doctors. Merry Christmas. I see Dr. Israel has good network today. Thank God.
I'm telling you. Merry Christmas. So you know the funny thing,
Merry Christmas,
Dr.
bro.
Fred will tell you, when I entered the first 2 minutes, I was going out and coming back before I decided to
Yeah.
change my network again. And this one is better.
Please, please permit me to go on audio today. I'm having post Christmas chow hyperglycemia right now.
Okay, it's allowed. Okay, so we have a question here.
Yeah.
Good evening, doctor. What can cause heavy menstrual flow for about 2 weeks?
Okay, if you're having menses for more than 2 weeks, you should go and see your doctor. Now, one thing that can cause menstrual flow to be more, one can be if the person is having a fibroid that is enlarged already and that is causing some problem. The same person may be having abdominal pain even before the start of the menses or during the menses, may be having abdominal pain. Also, another thing that can cause every bleeding, I would not want to call this menstruation again because it's more than your normal menstrual days. Normal menstrual days is 2 to 7 days. Yeah, once it's more than that, it's no longer normal. It's no longer normal. And for you to be having it heavy for 2 weeks, and I hope you are taking some you're taking some hematinics to even help you, because you may be having some plenty spare dizziness and all that because you are losing a lot of blood. I said fibroid can cause it. Endometriosis can also cause you to bleed like this. Now, if you saw a lady that is getting to his menopause and you notice such bleeding, you can be thinking of cervical issues, cervical cancer, and all that. And okay, I think that three I've said is something now.
Dr. T, do you have anything to add to that?
Yeah, so I tell people, thank you, Dr. Israel, for that. I tell people, when you're asking questions and we may need to clarify some things. What medications are you using routinely? Are you a Postinol 2 fan? Are you using something you're not supposed to be using? So, in addition to all these things that Dr. Israel has given you, still go in and give your doctor a full history. You need to ask you what medications do you use, what's your blood type, what have you been putting into that hoo-ha. So, what kind of symptoms are additional apart from the bleeding, like Dr. Israel said? Apart from the bleeding, what other symptoms have you been having? Those are the things that will help the doctor now know that, okay, this is what I should check for when I examine you. This is what I should check for when I. So when you go into the clinic, it's going to be a full workup. It's going to be a full examination so that the doctor can know exactly what's going on. But like Dr. Israel said, you're losing blood. You should look for a way to replace the blood cells you're losing, the blood you're using. So hematinics is your iron tablet. But see a doctor for a full.
Okay.
But say doctor to check.
How can my hobby boost his sperm? Dr. T.
Yeah. So the challenge I have with this is that what exactly you want to boost? You're asking a vague question. What do you mean by boost? I people that
Okay,
or you went someone and they gave you one diagnosis. Who told you that your husband needs sperm boost? Have you done an SFA, seminal fluid analysis, that told you that his sperm needs boosting? So this question you're asking is kind of vague. Go and see your urologist, go and see your doctor, let them do a proper examination for you. If they tell you need to boost your sperm, I'm sure they'll give you some things that you need to do. But for now, I don't know how to boost your sperm. There are foods that you can use, but really, go and see a doctor first so that you know if you need boost or not boost.
Dr. Israel, do you want to add anything?
okay. No, I think I will go with Dr. T because you remember I said this, Antonia. I've been asking um a lot of questions. Let me not say a lot of questions. So I think I remember when he asked a particular question, I said something. If you actually are having all these things, please go and see your doctor for a general workup. So now I think after I said that, you have to change it to the husband. So if your husband is having so many things also, please, you should go to the hospital and do a general workup.
I saw my period 2 times in a month. Is it okay or is not? Please let me know. Dr. Israel.
Okay, and one thing we should first of all know is that seeing your period is not a monthly thing. That's why we don't call it. Yeah, I know everybody. Most people call it a monthly flow. It's known as a cycle. It's not a cycle, eh? And you may likely have two cycle in a month. Yes, you may likely have two cycle in a month. For those that have short cycles, even in normal cycles, safe, you may actually have two cycles in a month. So if you see your first meses, your first cycle started, for those that have 28 days cycle, if you see your first, if it starts on maybe on the first second, you may likely see it same month. close to the end of that month. So that is like 2 menses in a month. Also, for those that have a short cycle, like 21 days, okay, let's say 24 days, 21, 24 days, you likely always see your menses twice in a month. So that's why we don't normally call it a monthly thing. And most of the time, I try to discourage people calling it a monthly thing so that we can actually say if this person is having problem with the menses or not. So it's a cycle thing, not really a monthly thing. So it's possible to have 2 menses in a month, but it now depends on their interval.
Dr. T, you want to add anything to that? We can't hear you. We can't hear you.
I don't really have anything. Some people have their cycles every 21 days. Some people have it every 35 days. Whichever way, the month is either 28 days in February or 30 days or 31 days. So if you have 21 days, for instance, you may have it twice in a month. And if you have 28 days, it may also happen twice in a month. If you have 35 days, it may even skip some months. So the cycle is what we are concerned. The Dr. Shola explained that.
Yeah. EC, good evening. Good evening. Ladies and gentlemen, why are you not sending stars? Why are you not sending stars? Why? People are just looking and asking us, no star. Good evening. Please, can someone that use the pregnancy test kits and test positive to pregnancy be pregnant without anybody's sign? Initially, she do have breast pain. Can it be pregnancy or not? Dr. T, we can't hear you.
Every pregnancy is different. It's not every pregnancy that you vomit in the morning. It's not every pregnancy that you have stomach pain and the things will be irritating you. It's not every pregnancy that you have breast signs. So the only way to be sure is your blood sign. Once you've done the blood sign and it tells you you're positive, the next thing you want to do, you want to locate the pregnancy. Oh, where's this pregnancy located? And those two can tell you if you are pregnant or not. You cannot use breast pain. If you are stressed, your bra is the wrong size, or you slept on the wrong side, or something is going on in your chest, and your breast is paining you, it may not be pregnancy. But if you have done the pregnancy test, especially the blood pregnancy test, the serum one, next thing for you to do is scan. Let's just locate where the pregnancy is. That is the only sure way. We can't use all these body signs. You may not have body signs. You know people that have never had body signs and yet they get pregnant. So that's my take on that.
Dr. Israel, you have anything to add?
No, I think I said it.
Okay. We're almost rounding up tonight. We're rounding up very soon. Please, any remedy for dry? Dr. T, any remedy?
Why you can't send this question to me? Well, so number one, a lot of women. One thing that you need to know is that it is not abnormal. First thing you need to know is that to have a dry vagina is not abnormal. So you may need to use lubricants. There are very many products, safe water-based lubricants. I said water-based so that you don't damage the cells in your vagina. So use water-based lubricants. They sell so many branded ones and they're quite cheap. And also, when you say dry, your partner should take time to stimulate you. It's not every time off pant, let me enter. No. Take time to stimulate. It may not be dry vagina. It may be just the fact that it's entering too fast and you're not properly stimulated. But if that is the case, go to your local chemist store. Tell them you want lubricant. Don't be ashamed of it. Don't call something when you want to buy condom. Go there and buy what you want to buy and enjoy your sexual life. That's it.
Dr. Israel, anything to add?
Yeah, and Dr. T have said it. What I will only say is that I want to try and please beg the same person that asked the question that you should not go and be looking for one pair or one stuff from the internet that you can put inside to see if anything. There's you only cause more problem to yourself. Now,
Yeah.
also, there's uh, if I may say, when we say dry vagina, most of the time it's just because the ladies are not really well stimulated, and that's why most of
Yeah,
them have that.
exactly.
Even the lady that think is actually dry, if it's well stimulated, something must come out. Something, yes, it may not be too much. That's why we can still call it dry. It may not be as much as making it too um, slippery that you not have pain, but something will still come out. So just use your lubricant. If you're in Lagos, maybe when you visit any good centers that also give HIV treatment, they have lubricant there for free, and they will give to you water-based lubricants. I let me not say any place, but if you any HIV center that you go, any HIV center that you go, good ones, yeah, majority of them have lubricants, yeah, which will help.
Okay, so I think we have to call it a day. We've spent an hour and one
It's nine
minute
o'clock
online
already.
today.
It's too fast.
Yeah, it's 9. So fast. So
It's so
fast.
fast.
Uh so fast. Though there's a last question here. Let's just take it for her sake. Let's touch this quickly. So I used to have fast breathing. I don't know the cause. Okay. Dr. Israel.
So fast breathing, there are so many things that can cause your fast breathing. And when we say so many things, we need to know that there's other questions that will follow this fast breathing. You may be thinking that you're having fast breathing and you're not even having fast breathing. It can just be your normal breathing. And that's one. Two, when you say fast breathing, are you being like you are not getting your breath, like you are short of breath? And three, is it all the time or after your exercise or you get tired easily? If you are getting tired easily, please see again. Sorry, not a gynecologist. See a physician, a cardiologist,
Mm.
or a cardiologist. If you are getting tired easily, with this fast breathing, you need to see a cardiologist. But if it's that you are having short of breath, maybe sneezing, cough will follow as well with the fast breathing. Yes, then you need to be talking of a respiratory physician. That's the person you want to see. Now, you also remember that recently we are having something what we call COVID now, which is an infectious disease,
Mm-hmm.
which can also come with this your fast breathing. So you can see that there are so many things that can actually cause fast breathing. So if you may just be surprised. You also want to see a infectious disease center where we want to
Yeah.
do some investigation to even find out if it's COVID or something else. Yeah, or something else. So I think these three I said are like the quickest one that can actually give you this, because if it's asthma, you need to see a respiratory physician. So, and Dr. T, you can help me out if we have more.
Yeah. So you've basically said it. I think I had this discussion on TikTok with someone earlier today, and the person was like, "Oh, my breathing is I'm usually short of breath," and I said there are a number of things. It could be the heart. Someone was even going moving stuff of right heart failure, and I said no. It may be the heart. It may be the lungs. We need to ask some other follow-up questions. What time of the day do you notice fast breathing? How frequently do you notice fast breathing? Does it come after you do exercise or does it come when you wake up? All those questions, see your physician, your doctor. They will direct you to the right people to see, either your chest or your heart doctor or the one that will look at your lungs, your respiratory physician, or you need to look at infectious disease, as Dr. Israel said. So you need to see your doctor. It's not something that can be just give you a list. There's so many things, like Dr. Israel said. Yeah.
Yeah, thank you everybody. Thank you for joining us. Any final words, Dr. T?
Yeah, I would just say the weather has changed now. I noticed it about 2 days ago. So it's now cold. The air is now dry. There's a lot of dust in the air. it may be a good time for you to put on your face mask if you're going to move in traffic, especially if you're not driving your own car or you're in a bus. Your face mask is not just for COVID, it's for dust particles from your nose. Dress warm, avoid cold things as much as possible, and lots of fruits and vegetables for this season. It will help with those dry mouths and dry lips and dry nostrils. Yeah.
Dr. Israel, any final words?
Okay, I will add that you also want to take a lot of water as well in this period. Yeah, water will help as well. And there's nothing much I want to say. I want to say a very big thank you to everybody that's always been with us. For how many years now, Dr. Fred? I
We
think
are
it's
going
up
to
to
we are
three
going to
years
the
now.
third year now. Yeah, three
Okay,
years.
we are going to the fourth year now. Yeah. For
Four,
these three
yeah.
Wow.
years, you guys have been with us. We want to say a very big thank you to all of you. On Sunday next week is New Year Day. And it's also going to be another wonderful day. We'll still be here. We'll
Wow.
still talk to you. Maybe we'll be having
Yeah.
a topic that we'll just do something like this. We don't know yet. Very big thank you to everybody. Please keep safe. Forget all this, forget all this enjoyment this period, and don't forget to keep safe. And because you are enjoying
Yeah.
yourself, eh? Don't forget to keep safe because
Mm,
you're enjoying yourself. I was with a patient.
mm,
Sorry, let me just say this. I was with a patient and he said, Doctor, what should I do now? I need this, I need that. I said, come and collect. And I said, see this period, nah, tribulation period, anything can happen. And I say, that doesn't stop you from keeping safe. Oh." I have to tell
Dirty,
him
dirty
on time,
December.
that doesn't keep you
Dirty
from keeping
December.
safe. So please, let's try and keep safe, even though when we enjoy ourselves and we are happy. Thank you.
Thank you, everybody. We don't take your presence here for granted at all. We want to say thank you for always coming here. Did you get the stars? I didn't see the stars. You sent stars. Someone said he sent stars. I didn't get it. Maybe after the live stream, I would see. I would check it. Chisom, thank you so much. And then, so to what Dr. T and Dr. Israel has said concerning the weather, I want to add, please try to take more fruits. Also, take fruits this
Mm,
season. Take your water, protect yourself with your nose marks and the dust around, and then take fruits. I think it would also help you very, very much.
yeah.
To all those that sent
Yeah.
stars, those that sent gifts online here, we want to say a very big thank you to you. Take care of yourself and have a wonderful night. Bye bye.
Yeah. Good night. Good
Good
night,
night,
everyone.
everybody. Good night.
Mhm.
Chisom, thank you. Thank you for the stars. I will check as soon as we're done. Thank you so much. Take care, everybody. Bye bye.